I'm so glad to see Rudra Prasad here in Castle Vijaypur, in almost the same place. I saw him when he was about a year old. He couldn't move his hands, couldn't move his legs, and he had a birth injury, because of which the neck was twisted, or there was some damage, and he had problems of blood flow to the brain here. Now, I live in London. He's here from one of the villages, local villages. So I taught the mother how to treat him. I taught her a neck connection massage, and she has been religiously following that. And I met him 2 years later. I was also training the NHS doctors, and he came to the clinic. I saw him. He had made some progress. I knew the mother was doing it for her son exactly as I had instructed. So we gave further instructions. Now he's come here to see me today. He's 16 years old now, and he's able to do everything possible. But today, while I was examining his neck, I found certain amount of stiffness in the left side. He can experience pain when I'm doing that. That means there's some vertebrae which are still not in alignment. Now, I will do a little adjustment to his neck, and we'll teach him some yoga exercises, and he can continue from here. He has some problem of memory, lack of focusing, and a little bit of logical problem. Imagine if he had not had these treatments or the instructions for treatments all those years ago. How are you feeling now?
I am feeling good.
Yeah? You can play football, can you?
Yes.
Oh, good. So we did it. Child had severe jaundice when he was born, 4 days after he was born, and he was in intensive care for about 12-13 days. He was given whatever treatment that was given, and after that he developed fits, epileptic fits. He started getting fits. He was bedridden, couldn't move. So it went on for a few years. Then they went to a big hospital in Delhi, and he had all the treatments there, epileptic and all that. He started recovering, but he's in this state. He cannot focus. I suspect that, as I do in most of these cases, that he's had some neck injury, because of which he had problems of blood supply as well. So I do this treatment whereby I improve the blood flow to the brain, and with that, many of these things, epileptic fits, cerebral palsy, even autism, they're taught. So let me just examine his neck and see if that is necessary. So I just touch the neck. He's feeling pain. I just touched it. I'm not even pressing hard enough. So the problem is there in the neck. So I'm going to teach the mother to treat, because I don't live here. Teach the mother the technique, and they're going to do it daily. Possibly go to Delhi and see one of my assistants in Delhi for the treatment. But there is hope. He can't speak, can't communicate, but I think we still have chance to help, as you've seen in the other case that I showed you. So this gentleman has traveled maybe about 50-60 kilometers to see me at the castle. He's had stroke about 11 years ago. Now he's experiencing some sort of pain in one side of the body. He still has problems walking, but he's made good progress. And so I'm doing the neck connection treatment to try and get more blood into the brain, and hopefully that will give him relief. It doesn't look like he's got any spinal problem, but I would just stimulate the lumbar vertebrae a little bit to make sure that it doesn't get any sciatica-like pain, because the direction of the pain shows he's got a bit of sciatica. Then we do this. दर्द में थोड़ा सा आराम है टंग थोड़ा सा आराम है So I just told him that one of his relatives have come, and I showed him the treatment, showed him where he should massage. So I did the neck and the lumbar region, and he says he's already got relief from the pain he had, on the outer thigh. So part of it was from the lumbar region, and I did the neck to get some blood, more blood into the brain, which is a requirement anyway after a stroke. So this is what I've done now. This 9-year-old boy had fever, very high fever, 4-5 days after he was born, and since then he didn't have any jaundice, just the fever, very high fever, and since then he's never walked independently. पहले काफी अकड़े हुए थे ऐसे, हाँ? He had a lot of spasticity before, and the spasticity is less. So I'm going to teach the father and the relative how to treat the neck area to get blood into the cerebellum. Stay behind the ears. So usually for cerebral palsy, this is a case of cerebral palsy, the high fever may have caused some damage to the brain, particularly the cerebellum, and so he had a lot of spasticity before. They say it's less, but he doesn't coordinate well. So that's why I decided to do my technique to get the blood into the cerebellum and help the coordination. with walking. रोटी पकड़ तो सकता है ना,
हाँ,
पर मुंह में नहीं लाते। हाँ, वो सिखाना कर करके थोड़ा सिखाना भी पड़ेगा। These are poor people living in remote areas, so they don't have the facility for treatment. So I'm trying to train the relatives so that whatever little they can do to alleviate this problem, they should do. Fortunately, many people follow the instructions because they're desperate. They have to do that. समझ गए ना? थोड़ा करके दिखाओ।
था ये रही।
हाँ, जो टाइट हो ना उस एरिया पे करना। रोज करो 20 मिनट, 3 महीने तक करो, हल्का खुल जाएगा, फिर उसको कोई सिखाएगा। हाँ, सिखाना तो पड़ेगा ना। So I'm going to tell the relatives what is important. You know, this artery, vertebral artery, sends blood to the cerebellum and all sorts of things. So it's in a canal here. ये जो खून की नाली है ना, हाँ, ब्रेन में,
हाँ, खून चालू हो जाए,
हाँ, खून चालू हो जाए तो लत ये सब ठीक हो, समझे ना? ये इसका करना है। Just telling them that, showing them the artery, you know, in a model. तो आप मालिश तो इधर से कर रहे हो,
हाँ,
पर इससे है ये खून जाएगा दिमाग। ठीक है, करते रहना। ओके, ठीक है भैया, थोड़ा थोड़ा दर्द होए कोई बात नहीं, सह लो। This 75-year-old lady had her fall, and after the fall she had a fracture in the femur joint somewhere, and with medicines and all that she got better. Now recently she's getting a lot of pain in this particular area. The whole of the leg, you know, it's like a sciatic like pain. So we're going to see where this pain is coming from. Let जाओ यहाँ पे. She's limping as well. एक दो तीन नीचे, 1 2 3 नीचे, ये 10 बार करना, ठीक है? फिर इसको पकड़ो, खूब तो जोर से दबाओ, हाँ, फिर इसको जोर से दबाओ। नहीं ठीक है, कोई बात नहीं, अब ठीक है, पहले दुखता होगा, अब तो ठीक होगा। वापस आ जाओ। आराम आए कि नहीं थोड़ा सा? She's very happy. She's smiling now. The pain is not there, you know, the horrible pain that she had, and she can walk comfortably.